the News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here on a Wednesday. Yes, this is a live program. I am in studio here at the News Channel 5 network headquarters on James Robertson Parkway. It is a skeleton staff, as we've had here. Most all of the people who can are working from home, but many of us, well, not many, I mean, some of us are going to be here at the station to deliver the news to you, and I tend to do that more in the morning along with the anchors and such, and to host MorningLine, of course, and we've got a good show on tap for you this morning. We're going to probably, for the foreseeable future, be doing stories and shows in relation to the coronavirus, and there are so many different aspects to it. We've covered a lot of them. There will be more to come, but one aspect that I think is very important and is going to come and become more important in the days and weeks to come as we start seeing the virus wane, and it will. We're going to beat this thing, but it's going to be a while. But what I'm talking about is, legally speaking, the law and potential lawsuits as it relates to how things play out with the coronavirus, which affects us all. And you can bet that's going to be something that a lot of people are going to be looking at, lawyers, of course, and we're lucky in a connection with this program, one of the foremost experts in medical malpractice, the medical aspect of law. And he's going to join us this morning to talk about that and take your phone calls. And for that, joining us by Skype is attorney Clint Kelly. Good morning, Clint. Can you hear me?
I can hear you great, Nick, and welcome to the future.
That's exactly what it is. We have a slight delay as this program communicates, but I think people can hear us. Let me ask real quick, Clint. Let's get right into it from the beginning here with regard to the coronavirus. Your observations from the legal side of things right now as you see things develop. I'm just wondering, what do you see happening right now as the law applies to the coronavirus? Where do you focus?
Well, right now, as you are aware, there are elective procedures that people have that have been suspended by the governor. People who have knee replacements, plastic surgeries, colonoscopies, the list is long. All those people now can't have that treatment, and those physicians and surgeons can't perform that treatment because the medical resources are supposed to be devoted to allowing other types of procedures that are emergent or to care for coronavirus cases. In 2, 3, 4 months, whenever we get past this suspension and these elective procedures are permitted, you're going to have a backlog going back at least 90 or 120 days, and you're going to have procedures that are going to be done back to back. I would imagine some even overnight, maybe 24 hours a day to catch up. Can you imagine what that type of assembly line medicine is going to look like when all these procedures are being done so quickly to try to meet the demand? There's going to be mistakes made.
Okay, another aspect I wanted to ask you about, Clint, and there's a lot of ground to cover this morning. We'll try to squeeze in some phone calls as well. But you have talked to me so many times when you've been on about how the fact that hospitals, to begin with, because sick people are there, are sick places, and the diseases and the germs and the way things move about. I wanted to ask you just your take with regard to the hospitals, the situation they're facing now, as we know they may be at some point overrun with corona patients, and the ability to try to keep it from spreading throughout a hospital. Can you talk about that? And are some of the same protocols that you've told me about with regard to, say, MRSA and others, can they work in this same way?
Yeah, the hospitals, as I understand it, are segregating the people who are sick with coronavirus. Like, for example, my sister-in-law works at Vanderbilt and says they've got an entire wing devoted to caring for people who either have it or are suspected of having it. And that's the way they're trying to prevent spreading through the hospital. Now, with regard to how to prevent the spread from patient to healthcare provider, that's a different matter entirely. Let me give you an example. Suppose somebody comes to the emergency room, says they have an abdominal issue, an abdominal pain of unknown origin, which could be anything from appendicitis to an upset stomach. And the doctor's treating that patient, believing that that's the cause. And then halfway through the examination, the patient goes, you know, doc, I've had this sore throat and this occasional cough that just won't go away. And so then all of a sudden, you've got a potential COVID-19 infection overlaying these other medical issues. And unless the healthcare providers are covered up and carefully protected, they can get infected that way. And my concern is just from a macro 30,000-foot view of all this. I'm afraid that the social distancing that was ultimately ordered and has been executed piecemeal is going to lead to a spike in the number of new cases that we missed an opportunity, let's put it that way. And so we're going to see the infection rate skyrocket here as well as other places. And these people who are sick, they're going to overrun the healthcare system. They just don't have enough healthcare resources to care for all these people who are going to need treatment. Some can stay home. Some who get sick will be okay, who have minimal or mild symptoms. Other people, Nick, they're going to be put on a ventilator to breathe, to survive. And these people have to go to the hospital. You can't get a ventilator at home. So I expect the healthcare system to be overrun. I don't know how well Nashville's going to compare up to other cities. I hope we do better because it seems like we got on top of it faster and better. But there are other cities that didn't. And those are the cities I'm concerned about going forward.
Do you think, and Clint, you're right, Nashville has a large medical community just from the fact that, let's face it, this city does, Clint, have the highest number of cases in the state. Davidson County does anyway. I mean, do you think just from your dealings and what you know about the local medical community, we're prepared to handle it here in the city better than other areas?
I do. I believe Nashville is better positioned to handle this because of its medical resources. I also believe, like I said, the mayor instituted this order early. Nashville got on it earlier than anybody else in the state, basically. So I think we're going to do better compared to others, and that's a good thing for us. My concern principally is outside of the Davidson County area, in some of the surrounding counties, and in particular the rural areas. I mean, Nick, last week, my paralegal was out on the way back from the office to home because she just goes to the office and then home. She doesn't stop anywhere on the way because at my office there's only 3 people working and they are at least 10, 12 feet apart. So, we're practicing social distancing at the office. She drove by Lowe's. Lowe's was packed. Yeah. There were people out there walking through the garden area, picking out shrubs and with their carts carrying, home improvement supplies. I just think there are a lot of people that are not taking this seriously. And when this thing comes through their town, we're gonna reap what we sow. That's my concern.
I couldn't agree with you more. It's a problem, and it's just baffling to me that some people have not gotten it through their thick skulls yet about how serious this is. I want to ask you just from your perspective as an attorney and what you see, and I know you do exclusively medical malpractice, those types of cases, but lawyers in general. The courts pretty much, it seems like for most things, are shut down. I know you may have had some trials scheduled and they've been postponed. The legal practice in general, though, I mean, is it still active? It's just not happening in the courthouses?
Yeah, it is active to an extent. Now, what I do and what a lot of people who do personal injury work do has been frozen to a great degree. The Supreme Court is trying to break that ice. They just entered an order last week that's encouraging us to use remote means like what we're doing here, Nick, to conduct depositions remotely, that is, take testimony remotely, to have hearings remotely. To have meetings remotely. So there are ways that we can accommodate to this in order to get business done because, just like the elective medical procedures are being backlogged, cases are being backlogged. And if we don't start moving forward and trying to find different ways to accommodate to this, justice delayed is justice denied. You're going to have people left behind, and the courts are just going to be overwhelmed. And so I applaud the Supreme Court for encouraging us to use alternative means, and this is what we're going to have to do in the months to come.
Yeah, I was just wondering, just from a practical point of view, how do you select a jury right now? Maybe you do it electronically if it comes to that. I know they're not choosing any juries, but Clint, how would you do that? You typically see a jury selection room is packed with people, isn't it?
It is, and that's going to be the #1 casualty of this, are jury trials, because I just don't think in good conscience I could ask a jury to show up And I wouldn't expect a jury to show up under these circumstances. Now, once we get through this, it's a different matter. And in particular, Nick, we've got to get testing. If we can get testing that will give us results in real time, then you can let people into facilities, whether it's ball games, courtrooms, concerts, newsrooms,
right,
whatever. Then you can be confident the people that are in there are not infected and you can go forward in business. But until we can do that, you're not going to be, I don't think you're going to be able to get people, particularly for a jury trial, to show up voluntarily in a space where they have to be around other people. And a jury box, you're sitting within 2 or 3 feet of somebody else. So it's clearly not safe right now to do that.
That's an excellent point. Listen, we're going to take a break, and it's what you just said really just hit me. There is some new development going on right now with a new test you may have heard of that can give you the results in a matter of minutes. And you're right, something like that would allow folks to be tested and instantaneously then go into a courtroom or go into an athletic event or something like that. I had not thought of it that way. It's a game changer, and that's in the pipeline. Listen, Clint, we're going to take a break. When we come back, we have several calls. I imagine a lot of people watching this morning. In the next segment, we're going to get into some of your thoughts and your involvement, as a matter of fact, in some legal cases with regard to that situation that happened in Gallatin with that nursing home. The very latest on that, and trust me, that's probably not the only nursing home that's going to have a problem. We'll take a break and be back with more right after this.